hi everyone, I'm Danielle. I'm one of the health and social care teachers at QE, and this is Ellie. Do you want to say what you are, Ellie?
Yeah, I also teach at Health and Social Care. I teach 2 of the first year units.
Okay, so this year we have someone put something, Danielle, you're sideways. Oh yeah. Yeah, so this year it's a brand new course. It is 50% exam and 50% coursework. You might have come on some of the open evenings a couple of years ago where it was 100% coursework. Well, this year it's changed now. So if you will be joining next year and the year after as well, if you are year 10, it will be so far 50% exam and 50% coursework. Okay, so what I'll do is I'll just go through kind of a little bit about the course itself, and then feel free just to ask any questions as well on the side, because they'll just pop up and we can answer them for you. Okay, so first of all, with health and social care, you can do a single or a double. So at QE, you will choose to do 3 different subjects normally, and they're an A level in each of them. So you could have health and social care, and then you could pick 2 other subjects. We normally recommend that at QE just because it gives you more of a wider range of obviously knowledge. You learn it's a bit more kind of it opens you up to more opportunities as well, rather than like limiting you and just choosing one subject. So a lot of people come to us, will do health and social care, then they'll pick another 2 subjects. So that's our single award if you were interested in just choosing 2 other subjects. On the single award itself, we have 3 exams over the 2 years, and it'll be 3 coursework, so it is just 50-50 down the middle. If, for instance, you were set on a health and social care career, and it was definitely for you, you either want to work in healthcare, social care, or you were thinking maybe it's going down the primary ed route, we do offer a double award as well. So that actually gives you 2 A levels. So what happens after the 2 years, you will have 2 A levels in health and social care, and that will mean obviously when you do start QE, you'll only be able to choose one other subject to study alongside that. So it doesn't limit you. But what it does is we only really offer double award to students that are definitely set on a career in health and social care, just because you can only choose one of the subject, that's all. Okay. Have you got anything, Ellie, you would like to say? We've got a question.
I think if we go straight to the question, Danielle, so it says, taking biology and chemistry A level, would health and social care link well with them A levels? Would it open more doors after A levels?
Okay, do you want to answer that, Ellie?
Yeah, great. So I think, if you are going into a health and social care career, it can be really useful to have those science A levels as well. I think as well, because biology and chemistry A level are really quite, they can be quite scientifically complex subjects. It can be quite nice to have the health and social care as well, because then you do have that 50% coursework, so you're not just sitting loads of exams at the end of your 2 years. You have got coursework throughout, which it reassures some students as well, because then you kind of get a feel for how you're doing throughout. Now, as to whether or not it opens more doors for after A levels, I think we could talk about skills. The skills that you need to be doing any kind of coursework-based subject. They are different to the skills that you would gain just from purely doing exams, and that kind of time commitments, working to deadlines, staying organized, that's really useful for any kind of career that you would like to go into.
Perfect, yeah. Another thing as well, I've got another question. Would it matter if I only had one? So basically, I think this question, are you on about, so it says, would it matter if I only had one award and wanted a job in health and social care 100%? Do you mean
I think
just
that's the single rather than...
Yeah, so is that yeah, so if you wanted to just do the single, yeah, that's so basically Obviously put another question if I haven't answered this, but basically some students do the single award and actually still want to be a midwife, paramedic, or go into health and social care. But what it does is having them other two A levels, they just make sure it links to the actual like career that you want to do. So a lot of our students do like to have 3 different A levels, and you're not at any disadvantage for just doing a single award. So what it does mean is that you can choose 3 other A levels, and obviously that'll help you to, when it comes to choosing what you want to do, have more of a broader knowledge. Say for instance you were wanting to go down, say, the health route, and do paramedic science or midwifery or something like that. A lot of our students do health and social care. They then normally do a science, and a lot of entry requirements for university, such as like midwifery, some of them actually ask for an A level science. So normally they do biology alongside. Quite a lot of our students do like applied science as well as health and social care as well. So don't feel like you have to choose a double health and social care. Most of our students do choose a single, and I would say most of our students actually go into a health and social care career after it. It just makes sure that the other subjects would link to where you're wanting to go. Specifically like science, if you want to go down the health route. A lot of them do sociology or psychology. So psychology, if you wanted to go down more the crime, well, actually we've got criminology as well, so that links. So if you wanted to go down more of the mental health route, the kind of link with psychology, criminology, and health and social care as well. So yeah, just a single would be great to still have a career in health and social care. Let's have a look at this question. So I want to be a counsellor and was thinking about double health and social care. Is that a good thing for me to do? Yeah, absolutely. So a lot of our students do like the social care sector. So normally what they do is they do the double if they're definitely set on it, just because we have quite a lot of units that would be tailored for what you want to do, and more specific as well, which would be perfect when you're writing obviously university personal statements and things like that. I would probably, if you wanted to go down the counselling route, if you were to do a double, pick a subject that would go quite well, or something that you enjoy, because obviously if you're picking the double award, that's where your most of your like personal statement would be from the double, from all the information that you've done from there. But yeah, no, you could do the double or you could do the single as well. If you want to know a little bit about the units as well, the difference between single and double as well, please just put that in a question. I can go through some of the subjects as well. If I want to be a social worker, would single or double be better? Honestly, it doesn't matter, single or double. If you definitely set on social working and counselling, possibly if you've done health and social care before, or if you haven't, but you do, if you are interested in it, do the double award. We only don't say to do the double award if, for instance, you're not 100% in health and social care, just because so many do double, and not like an odd few will do double, but then all of a sudden they want to do something that's not even related to health and social care, but because they've only done one other A level, they're a bit limited, when writing the personal statement. So yeah, it's completely up to you. If you're set on health and social care, it's definitely a great course, and double award is great, especially if you're kind of set in that kind of career, and then at least you only need to choose one other A level when coming to study at QE.
So we've got a question here, Danielle.
Yeah.
I think I'll just jump in with it. So is there an option to take a double award with 2 other A levels? We would not recommend that, just because the double award is the equivalent of 2 A levels. So now, instead of doing how we used to, where you would do 4 ASs, you would then drop 1 and you would go on to do your 3 A levels. You pick your 3 A levels and that's what it is that you go with. We very rarely suggest that students would do 4 A levels, so no, it's unlikely that you would be able to do the double award with 2 other A levels, just because of the work kind of commitments that you would have with that.
Yeah, just obviously going back to Ellie's question as well, there is you would actually have enough points to get to university from just 3 A levels as well. And especially if you're getting good marks, you wouldn't need to do a fourth one. And a lot of students as well, it would be extremely hard to balance it all anyways. So that's why we wouldn't recommend it in terms of, we'd rather you just focus on the 3 A levels, because they'll be hard enough with obviously exams and coursework as well. Do you want me to, Ellie, go through the single topics?
Well, I could talk about
Yeah.
the two that I teach. So
Oh yeah.
in your first year single, your two exams that you do, I teach both of them. So the first one is Equality and Diversity in Health and Social Care, which is a really, really brilliant unit. You know, we really enjoy teaching it. We have a look at, you know, how can we promote equality and diversity in different health and social settings? What are the consequences if we don't? The exam that you sit, I believe, is 90 minutes, and it's got a mixture of questions in it. So all of your exams will have this mixture of types of questions. So some of them might just be, you know, 1 or 2 mark identify questions, or they could be longer 6, 8 mark analytical questions. So you do equality and diversity in your first year, and then you would also do health and safety at work, which is the unit that we've just started this week. So we have a look at different hazards, we have a look at the legislation. You know, how do we ensure that we are keeping people safe? So not just, you know, our employees, how do we ensure that we're keeping service users safe, you know, individuals who need that care? What different roles and responsibilities do we have? So in your first year, those are the 2 exam units. Then you'd also do a coursework unit, which is communication, and Danielle teaches that one.
Yeah. Yeah, so obviously in your first year, you'll have your 3 subjects. So like Ali said, you'll have your 2 exams, and then you'll have a coursework subject. The coursework subject I teach this year, and it's called Building Positive Relationships. It's a bit like communication. I don't know if you've done that possibly in school. And what we look at is barriers to communication. So we look at like dementia, and we look at like elderly kind of disorders that would stop people from communicating. We then look at child, like early years as well, because a lot of students do want to go into teaching and work with children. So we do like early years, and we look at like autism, ADHD, any kind of learning disabilities that would stop someone communicating. And then we just look at how to overcome them. So we do a role play as well in the last assignment, where you just role play how you would overcome barriers to communication. So yeah, so 3 subjects in the first year, 2 of them exams and 1 is coursework. And then obviously in the second year, you'll have the opposite. So it'll be 2 courseworks and an exam. So it's just 3 and 3. Okay, so what grades do you need? So obviously we do highly recommend that you do have your like a 4 in at least like 4 subjects. On health and social care, you can resit an English or a maths as well as alongside it. So at QE, we do offer resits for GCSE as well. So if you don't get a 4, you can still join, obviously, as long as you've got the entry requirements for the others, you can still join, and then you'll be resitting your GCSE, either maths or English, but you'll have to choose 3 A levels still. So you're on 3 A level, like a full program basically. So what that will mean is you will be doing 3 subjects of A level like you normally do, and then in your actual timetable, when it would normally be freeze, your freeze, like some of them, not everyone, will be taken up with GCSE lessons as well. And then as soon as you pass them, you're then in your second year. So if your first year you pass it, your second year you'll just be doing your A levels. So it'll be a bit more intense, obviously, with your GCSE put in there. But the good thing is, you'll hopefully after the first year, that'll be taken away by the second year when you've obviously got your exams from the other A levels as well. Okay, so how many days a week would you be coming in? Okay, so at QE, every student picks 3 A levels, okay? So that means that you would be in 5 days a week. So you're in every single day. However, you're not in from 9 till 4:10. So our normal timetable is lessons start at 9 and finish at 4:10. But throughout that, there's 5 blocks in a day, apart from Wednesday when there's 4, and you will have frees. So you might have a free period 1, which means you don't start till 10 to 11. You could be just having, like, you have about 3, I think about, was it 4 frees, Ellie, that they have if they've taken the 3 A levels. I'm
Yes,
trying to add them
I
up now.
think so, yeah.
Yeah, because then I'm trying to think with the GCSE as well. So you will have frees blocked through as well, and but you will be in 5 days a week at QE. And if you pick the double award, which this question was specifically, you will have 10 hours of health and social care fitted into your timetable. So if you choose a single, it'll only be 5, and then it'll be 5 for your other subject, 5 for the other subject as well. But obviously the doubles double the amount, so it will be it'll be the full 10 hours of health and social care that you'll be in.
Just to clarify, that's contact time in college with your teachers. That's not what we would recommend overall. You know, for each subject that you do, we always say that there's going to be the 5 hours of contact time, and then we advise that there'll be another 5 hours or so on top of that of independent work. So, you know, it works out. What we expect students to be doing is 15 hours of contact time per week for their subjects, and then an additional 15 hours for their independent work. Now, when it comes to the double, you may find that, you know, actually there's a lot of time in lessons to get work complete. You may feel that you don't have to do as much at home potentially. You know, you do have really good support with your teachers to be getting that done in college, and you've got your frees. We have computer rooms, so you can, you know, go and work there, so you don't necessarily have to take all of that home with you. But yeah, so you'd be in every day, and that's what we would be expecting. Okay, I don't think we have any more questions at this point in time. We're about due to wrap it up anyway. Or Danielle, is there anything else that you'd like to say?
No, well, what I'd probably just say is that if you are thinking of like, so any questions like specifically for health and social care, or you're unsure about health and social care or the difference between single and double, what I'd probably recommend is just contacting the college, and myself or the other health and social care teachers can obviously just answer any questions, because obviously it's a bit hard with everything online and not being able to meet you face to face and things like that. But like I say, if you've got any questions at all, to obviously do that. If you've applied, I think I had a question about someone who applied and wanted to change to double. If you have applied, do not worry too much, because you can change them still on your application. So you just contact the college. So if you put down that you want to do the single, but actually you are thinking of possibly the double award, just contact the college and they'll change it for you. Don't worry about, obviously, if you've picked them and you think that's it. You can obviously change your mind all the way up to when you do start. But ideally, when you start your subjects, we don't recommend anyone changes. So what I would definitely do now is just spend the time to try and think of what career you want to do. If there's any questions at all about certain subjects, just email, just get in touch with the college. They'll give you your own emails, and we can obviously we can let you know about that. Yeah, so I'm a health and social care teacher. Ellie is a law teacher, so she'll teach law, but she also teaches health and social care as well. And we also have another 2 health and social care teachers that'll be teaching like on the course. Hope that answers the question. So yeah, we're not all here, but we definitely teach on health and social care that are here now. But yeah, so what I would just say is, before we go, is definitely if you're thinking about applying, go onto QE's website and go onto the application form, fill that out. If you're unsure, get in contact with the college, and we can obviously ask any questions about subjects. And then as well, follow us on social media. We constantly post things out about what we're doing, what the course is like. So that's the Facebook page and the Instagram, and that'll be on the website as well. Okay.
Okay, I think that'll be it. Well, thank you all very much for coming along. Some really good questions there, and hopefully we get to meet you soon.
Yeah.
Thank you. Bye.
Thank you. Bye.